The biggest shock that I got when I became a paramedic wasn't the blood, it wasn't the trauma, and it definitely wasn't the patients. This is what nobody warned me about. Hello and welcome to another episode of Paramedic TV. My name's Tommy and this is presented by Pocket Clinician. When people think about becoming a paramedic, they think about the major trauma, the driving on blue lights and the cardiac arrest, but actually the biggest challenges in this job are the things that nobody talks about, and it completely blindsided me when I became one. So here are all of the things that shocked me when I became a paramedic. So first up on the list is understanding the reality that nobody knows everything, and I'm never going to know everything. It occurred to me a few weeks ago when I had a student with me. We were going to administer a patient some ondansetron, which is an antiemetic for sickness. And the student, they turned around to me and they said, "So what are the actions of ondansetron?" And I was thinking, why do we need to know that? But it's right, the best learner is a critical one. And to think like that will overall make you better at clinical reasoning. Now, I know that it blocks some receptors that makes you feel sick, but I couldn't explain it in simple terms like that. So I simply just said, look, I don't know. And we Googled it and we learned something new that day. The other thing is when a patient has a fairly complex or rare medical condition that I've never heard of before, and I ask them what their medical history is, and they say, yeah, I've got, for an example, Hashimoto's thyroiditis. And I was like, what is that? And the patient was like, how do you not know what that is? And yeah, their endocrinologist knew what that was, but that's a doctor who specializes in that field. And yeah, a quick Google solved the problem. But, there's lots of things that I do when I don't know what to do. And it is rare these days, to be honest. But there's also lots of support in the ambulance service for paramedics and all sort of types of clinicians that work on ambulances. There are senior sort of advanced paramedics that work in the control room, and you can call them for advice on a drug that you've never given before, on how to manage a patient if they're in a complex sort of way. So there's lots of support around you, whether you're newly qualified or whether you've got 10 years experience on the road. There's always someone that you can call upon. The second thing that shocked me when I became a paramedic was the fact that most of the patients that we see aren't life-threatening emergencies. A lot of them are low-risk chest pain, falls, social problems, welfare concerns, and those aren't really the things that you get taught at university, especially when it comes to social problems. And a lot of these things you see more senior people manage a patient with a social problem, like they don't have any carers at home, but they need a package of care put in place so that they can remain safe at home. And as a paramedic, you don't really get taught how to manage those things, and it takes a while to see other people do it and say, okay, fine, that's the way that I'm going to manage those patients in the future. But sometimes it's a bit difficult, and it can cause a lot of people to become a bit jaded in the workplace, because at university, all we get taught is cardiac arrests, major trauma, how to stop catastrophic hemorrhages, heart attacks, strokes, and things like that. But we don't really get taught how to deal with a mild chest infection, which sounds simple to someone who is experienced because we deal with it a lot now. But when you first start out on the road, you don't really know how to do these things. And I think the other thing that causes people to become jaded is the fact that when you call an ambulance, you call 999. That's the emergency number. On the side of every ambulance, it says emergency ambulance. And so you kind of question yourself, okay, why are we calling ourselves an emergency service if we're not going to life-threatening emergencies? But I think the definition of emergency has kind of changed a little bit. Now, yeah, an emergency could be someone who has just collapsed and they're in cardiac arrest, but it also could be an elderly person at home whose wife has been taken into hospital and they have no carers to sort of look after them. And that could be their emergency. And sometimes, because how stretched the NHS is, there aren't services to deal with these things, like patients who have a fall and that aren't injured. So it all sort of comes down onto the people who you can call upon in any situation, which is the ambulance service. And so, yeah, I try not to get too worried about the fact that not every job is a life-threatening emergency, because also, let's face it, if it was, I don't know how long I could last as a paramedic if every day I was being hammered with life-threatening patients every single time. The third shock to the system when I became a paramedic was it was the jobs that stay with you. A lot of the time you think that the jobs that are going to stay with you and get your demons going at night are the cardiac arrest or the major trauma or all the blood that you see. But actually for me, and everyone is different in this, but for me, it's just the small things. It was an elderly gentleman who lived alone, who had a terminal illness. He had no family to help look after him, and it was just district nurses and carers that came to him a couple of times a day. But apart from that, he was spending the last few days of his life just in bed, alone, waiting for the next person to come in to change his pad or make him a cup of tea. And I found that really sad. And yeah, it took me a while to get my head around the fact that there are lots of people out there that don't have anyone to call upon, like family or friends, and they do rely on the social services and the system of the community services that we have to simply look after them and socialise with them. So yeah, it's a bit of a weird one, and like I said, everyone's different. You might go to a cardiac arrest and that stays with you. Just look after yourself in all of the jobs we go to, not just the big major traumas or the gnarly patients with blood all over the floor and things like that. To celebrate the launch of Paramedic TV, I'm giving away a student paramedic bundle. To enter, simply subscribe if you're watching on YouTube or follow if you're listening on Spotify. That's it, and the winner is going to be announced on episode 5 of Paramedic TV. Good luck and enjoy the show. The other thing that shocked me when I became a paramedic was the public misconception of what an ambulance is actually for. I remember one of my first ever shifts, I went to a hotel for a patient who was in their hotel room having some sort of emergency. And as we walked into the reception, we got intercepted by some other guest. They said, "Oh, excuse me." And I thought, "Oh, we here for you?" We got told that they're in room 300 or whatever. And they said, no, we didn't call, but would you be able to quickly check my blood pressure? And I was thinking, hang on a second. You've just seen 2 paramedics carrying a load of kit walk through the doors of a hotel. There could be anything going on. There could be a woman in labour. It could be someone having a stroke. And you've just interrupted them and said, "Yeah, can you just check my blood pressure?" And I thought, I would never do that. That's crazy. But then I remembered, I've grown up in a world where, yeah, ambulances are just for emergencies. But some people have never had any interaction with the ambulance service. They've never had any family members work for the emergency services. They might not have seen the Paramedic TV show, so they might just see us as these healthcare professionals who just go around helping people. Can you take me to a different hospital because I don't want to go to this one? It's rubbish. I've had a bad experience there.
What?
Unfortunately, the way that the ambulance service works is we have to take you to the closest A&E department to you. Unless you've got a condition that requires a specialist team, then we can take you to a specialist hospital that might be a bit further away. Sometimes I say to patients, do you know what? There's not really much I'm going to do for you on the way to hospital. You're very stable, and I think that it would be more than appropriate for you to take yourself up there if your husband or your girlfriend can drive you. And they're like, "Oh, well, don't I get seen quicker if I go in by ambulance?" Misconception. You definitely don't get seen quicker by going by ambulance. Sometimes actually it takes longer to be seen if you go in by ambulance, because when we get there, sometimes there's a queue of sort of 4, 5, maybe 10 ambulances waiting to hand over. So we then take half an hour just to hand over the patient to the nurse, and then that's when the clock starts. When actually, if you self-presented to A&E, then you would just book yourself straight in and be triaged fairly quickly, a lot quicker than what we would get you triaged by the handover nurse. So yeah, you're not always seen quicker if you go to hospital by ambulance, unless you have a time critical condition that needs urgent treatment. Another thing that shocked me is how brutal the profession can be. So when I qualified, I was quite eager to help student paramedics because there was a lot of things that I needed when I was a student that wasn't really out there, which is where Pocket Clinician started. And I found that the egos on a lot of people, and I don't know why, it seems to be in the ambulance service more than a lot of other professions. It's really difficult to battle. And this can be in a team dynamic where you make a decision and someone wants to go against you just for the sake of it. Not necessarily because it's unsafe, but they just want to go against it. There's 10 ways to skin a cat in this job, and they want to do their way because they want to be the leader. And yeah, it's a funny culture of, slagging people off who might not be fully there yet with their sort of being competent at the job, and that's okay. We get paired experienced people and then with an inexperienced person, and the idea is that you can teach that person the ropes of the job so that they become experienced and then they can pass on all of that information to the next one. And it's a constant rolling circle of people mentoring inexperienced clinicians. They then become experienced and then they mentor the next ones. And yeah, it's a funny old culture where, if someone is a bit funny or a bit weird, they get talked about, and it's a very, very funny culture. And considering majority of the ambulance service is neurodivergent, there's lots of funny people with weird quirks knocking about. But yeah, people love a bit of gossip in the ambulance service, and it's really difficult to sort of sort that out. The thing that I didn't realise that would occur to me is what I call an emotional hangover. So you can do a 12-hour shift and you're back to back seeing patients, being really empathetic, drawing out all of your emotion to reassure the mum of a really sick kid, or reassuring an elderly lady that has dementia and is confused and doesn't know what's going on. And it requires a lot of mental effort to reassure these patients and try and sort them out and get them treated and get them the right help. So when I come home, sometimes I just want to sit back, relax, watch some TV. But the reality is I've got a family, that doesn't work. And you almost feel, the reason I called it a hangover is it's almost like the pain from the night before. Well, this is the pain from the 12-hour shift that I've just done. And it's emotional hangover. So just be aware, it's completely normal to come home from shift and just feel mentally exhausted. And I've got quite a good relationship with my family. They know what the deal is. And if I'm not in the mood to hang out the washing, go down the shops and pick up some milk and everything after shift, then there's this sort of agreement that we've got where, okay, let's just give him a bit of time to chill out, and then hopefully give him an hour and he'll be back into it. And lastly, the biggest shock of them all is the systematic realities of the job. You hear about delays on the news and things like that, but geez, when you get on an ambulance and you sign on and the first patient that comes down to you at 6:30 in the morning has been waiting for an ambulance since 10 o'clock the night before, you get there and you're thinking, geez, this person could have had a whole sleep waiting for an ambulance. It's crazy. And you get there and they're like, what are you doing? It's 6:30 in the morning. I didn't call it till 10 o'clock last night. And, the systematic sort of issues within the NHS and the ambulance service really are a bit of a shock to my system, especially when I first started. The other things that it sort of goes on to is when you're handing over a hospital, sometimes that can take half an hour to an hour just to hand over your patient at the hospital. The reason being is because if there's no beds in the A&E department, that nurse can't accept your patient. So you have to wait until a bed is available so that you can then hand over your patient and pop them in the bed. Most recently, what they've been doing is something called corridor care, which was introduced during COVID, which has unfortunately sort of become a norm in some A&E departments when they become busy. And the idea is that the patient gets brought in by ambulance and they get put in a corridor, and there's a nurse in the corridor that goes and triages all of those patients, and then the doctor will come round and start treatment in the corridor. unfortunately for us as paramedics, sometimes they're still on our bed, and we need our bed to go back in our ambulance so that we can use it for the next patient. And so we're sort of stuck there, sometimes even doing corridor care for our patient. I had a patient that was in a lot of pain, and they'd already taken some paracetamol about 3 hours before our arrival. So we couldn't give them paracetamol, so I gave them some morphine, took them to the hospital, and there was a sea of patients down this corridor. And so it got to the point where the patient had reached their 4-hour mark of having paracetamol, so I could give them some more. So I sort of drew up some paracetamol and gave it intravenously in the hospital, which is something that you would never have done 8 years ago. It's crazy. So those are the things that nobody told me about being a paramedic before I became one. I hope you enjoyed that. Now, this is obviously the second episode of hopefully a very large YouTube series, and I've got so many plans for this. So one of the things that I want to start fairly early is doing Q&A videos, so question and answer. So if you have a question, pop it in the comments, whether you're watching it on YouTube or listening to it on Spotify, and I'll collate all of those questions and create a question and answer video once a week. Now, it requires people to actually ask questions, so I'm only going to start it once I've got a decent bank of questions to answer. So yeah, if there's anything you want to know, then feel free to pop it in the box. Apart from that, I would really appreciate your support, and that means pressing that subscribe button if you're watching on YouTube, or clicking that follow button if you're listening on Spotify. I hope you enjoyed it. My name's Tommy, this is Paramedic TV. I'll see you next time.